Hello, my name is Michael McLennan and welcome to COVID Matters. In this episode, myself and Cheryl were delighted to discuss These Four Walls. It's a short film giving voice to all those who've been bereaved during the COVID-19 pandemic. For this, we were joined by Dr Lucy Selman from the University of Bristol. She's Good Grief's founding director and These Four Walls co-principal investigator. We also spoke to Dr Emily Harrop from Cardiff University, who is also a co-principal investigator and who we've spoken to for this podcast previously. Also in the conversation was Ellie Harrison. She's the creator of the Grief series and the writer and director of These Four Walls. I hope you enjoy our chat. I'll be back afterwards with more information about both These Four Walls and COVID Aid.
Just to begin with, please can you tell us a bit more about your working background?
My name's Lucy Selman. I'm an associate professor at the University of Bristol and I'm a social scientist. So I don't work clinically, but I've been doing work in palliative and end-of-life care since about 2004. And I have a particular interest in grief and bereavement, but also people's experiences of living with serious illness, communication about treatment decision-making, and those kind of wider issues around living with and caring for people with serious illness.
So my name's Emily Harrop and I'm a research fellow at Cardiff University. And similar to Lucy, really, I'm a social scientist by background and have been working in the field of palliative care since 2011. Looking again at people's experience of living with advanced disease, and increasingly in the last few years around grief and bereavement. That's where my work's come to focus, and all the more so during the COVID pandemic, where I teamed up with Lucy and we've been working together on this study, which we'll be talking more about today.
I'm Ellie Harrison and I'm an artist. And since 2010, I've been making projects co-authored with communities to open up spaces to talk about grief and bereavement and end of life. So sometimes that looks like photography projects where we take portraits of people from 7 years old to 85 years old. And sometimes it looks like a fun fair about anger called The Unfair, which pops up in town squares and parks. So, and during COVID, I ended up doing a lot of grassroots signposting. So people were ringing me at 6 a.m. saying, what are the funeral restrictions in Stockport? Or I've been told this about my mother's funeral, is that true? So it was a lot of making 10 phone calls, so they only had to make one, really. So very kind of grassroots and activist, I suppose.
So it's great to have the three of you with us today. What we will be talking about is These Four Walls, which of course a short film written and directed by Ellie, who's with us today. And the research behind that was conducted by Lucy and Emily. So I wonder if you can tell us a bit more about that research and what the study was aiming to uncover.
Our study was looking at people's bereavement experiences during the COVID-19 pandemic. It's involved a survey of people who were bereaved at this time and also some interviews with people bereaved at this time. And the aims of the survey were really just to try and understand a lot more about these kind of unusual conditions in which people were finding themselves in when they lost relatives and friends during the pandemic. So we looked at people's experiences at the end of life, people's experiences of funerals, of the support that they needed and perhaps weren't getting. And the idea behind it being really to try and come up with some, practical recommendations and suggestions for trying to improve the care and support available to people at this time.
And this was a national study, am I right to say that?
Yes, it was a UK-wide study. Yes, so it was open to anyone who had experienced a bereavement in the UK during the pandemic.
So were there any overarching themes that you found as a result of your findings in this study?
So I'll chip in here, it's Lucy. So overall, I think the findings from the study really highlight the exceptional challenges of bereavement during the pandemic. And our research was focused in particular on that first sort of year, from March 2020 up until the end of 2020. So people were having to cope with lockdowns, restrictions to funerals, like Ellie mentioned. And also, I think what really came through was how these restrictions impacted on people's ability to say goodbye to their loved one and spend time with them after the death, and then give them the send-off that they would have wanted in terms of a funeral. And then after that, people ended up suffering, I think, because of the way their social support network, which they would usually rely on, so their friends and family, were just not accessible in the way that they usually would have been. And that had real knock-on effects in terms of their experiences of grief and their experiences of bereavement and being able to cope with their bereavement later on. So people talked about feeling that the bereavement was almost unreal, like they couldn't really make sense of it in their lives, and they were unable to sort of integrate it. I don't think you ever really move on from a bereavement, but as time goes on, people usually have the opportunity, but also they have to go through that kind of social aspect of integrating it into their lives, of seeing people for the first time, of going into work and all of those things, which maybe we take for granted. And during the pandemic, everything sort of was on hold for a lot of people. So I think that was one thing that came through, wasn't it, Emily?
Above everything else, it just highlighted just how challenging it had been in kind of all aspects of grief and bereavement, really, from the end of life through to trying to access services that people would find to help them as they were coming to terms with their grief.
And definitely having a pause on ceremonies, it kind of halts the closure that people can have when it comes to dealing with a death or a bereavement in the family, or even friends being able to say goodbye to a loved one or a friend. So did any of these findings surprise you? I suppose I can ask each of you to respond to this. Ellie as well, because of your work with grief and bereavement. Did any of the results surprise you in the end?
I don't think the research findings surprise me necessarily, because in my work, so much of it is about helping people make meaning. And in my case, we do that through art. But it's also about having communal spaces to bear witness. So in some ways, it wasn't surprising, because I really was acutely aware of the loss that people would be feeling in not being able to mourn and mark those transition points. I think what I did find surprising was just the wealth of research and how rigorous and nuanced the research was. Lucy and Emily spoke to over 700 people, and it was quite a challenge as an artist. How do you bear witness to so many stories and such, and how do you communicate such beautifully nuanced research in a visual language? It was. I felt very honoured to be invited to do that, but also really, really tough brief.
I think from my perspective, what really came through, perhaps it's not surprising, but what really struck me was the high levels of need for emotional support and the sort of the psychological difficulties of what people were going through. So although there were sort of practical challenges around kind of death administration and organising things and trying to work out what the rules were and things like that, and people did have some needs for support around those kind of issues, what really came through was just the huge sort of trauma that people had gone through, really, and how traumatic a lot of the end-of-life care experiences were, and just how difficult it was for people. For example, we had people talking about how they feared or knew that they had actually given the person who died COVID, and then the person had ended up having to be admitted to hospital, and their loved one died there and they weren't able to be with them. So that person then may have ended up at home on their own, having to isolate or quarantine because they had COVID themselves without any social support. And on top of that, they're dealing with this really traumatic experience of saying goodbye to somebody who then got taken off in an ambulance, and the guilt associated with the fact that they may have given them COVID. And I think those kind of challenges were just really unique. And we saw that kind of play out in our both our survey data and then the in-depth kind of qualitative data we collected as well. And then I think the other thing which really struck me was just how difficult it was for people to get support, like professional support, whether it was from mental health services or from bereavement charities or GPs. So people really struggled to be seen and to get the kind of support that they wanted often. So people did have a need for and wanted to have face-to-face support, for example, sometimes. And obviously that wasn't possible. People could perhaps get online support or telephone support, but that wasn't necessarily what people needed. And people also tended to feel that the experiences they'd had of being bereaved during the pandemic weren't necessarily understood by other people, including their friends and family. And so that there seemed to be quite a lot of division and isolation that was coming through in people's accounts.
And in terms of these four walls, why do you think it was important to translate this research into a short film?
I mean, I think it's important doing any research really, that you try and convey your findings in different ways. I think traditionally researchers have written academic papers and kind of left it there, and I think increasingly now there is, it's quite well recognised that it's really important to feedback what you're finding to lots of different audiences, including the public and also people who take part in the research. So I think on one level, it's creating things like films is a really good way of doing that. But I think it was also really important to really, one of the aims of this study was to really document what people have been through. So as well as being able to, understand more about experiences, it was just, bearing witness to it and really being able to explain get the messages out around what people had actually been through during the pandemic. This seemed really important. And a lot of the themes that we were picking up in the research and some of the other sort of feedback that we've been getting from when we've been talking about this stuff was that people felt quite abandoned. They felt poorly understood. They felt that no one else really understood what they were going through. So it seemed really quite important to try and give that voice to their experiences through a film. I don't know if you want to say more about that, Lucy or Ellie.
Yeah, I think that's true. I think our motivation was, one of our main motivations was to try and convey what people had been through, so that, those family and friends that I mentioned, not everyone will understand. Not everyone has a network who would necessarily understand what it's been like to be bereaved. So it was partly to kind of raise public awareness of that, but also I think kind of clinical awareness and awareness among counsellors as well of just what people have been coping with. Some of the reporting in the media has been quite sensationalist, and that's not always helpful. So as Ellie said, in our research, we were really keen to give voice to the diversity of experiences and also the nuances in people's experiences, and maybe give a few pointers of what people can do to help, whether you're supporting someone because you're a friend or a family member of someone who's been bereaved, or if you're a professional who's trying to support people who've been bereaved at this time.
And I suppose from my perspective, I made the film with an artist and videographer called Matt Rogers, and we were thinking about how do we communicate both the scale of the findings, but also make each story feel individual, because when you see a number, it can sometimes be difficult to engage with the individual story. So we were thinking, how do we communicate what people had for breakfast, the way that they dressed, the way that they were in life, and what incredible loss was experienced by their friends and family. Actually, although I said that I wasn't so hugely surprised by the findings, one of the things that came out was that people felt they weren't entitled to support. They were like, oh, I'm not sure whether I really deserve it, or other people have it worse. And that I really sort of felt that on a human level and wanted to offer permission. So I hope if the film is trying to achieve anything, it's to offer permission to bereaved to feel and to know that they're not on their own, and that it's that there's been so many people going through this.
And one of the things, actually, I think Emily and I, when we talked about commissioning a film, was we both felt really strongly that the person who made the film needed to really understand deeply what grief was and is. And so we approached Ellie for that reason, because we knew that, she'd explored grief and loss a lot in her work previously. And it is a sensitive area, and you want to do justice to those stories that people have shared with you. So we really appreciate that, the way that the grief series kind of approached the brief and respectfully, represented our accounts, but in an artistic way, which we hope is accessible to people as well.
Yeah, and I suppose art can be a wonderful emotional accessibility ramp into difficult topics. And when we're dealing with trauma, sometimes things are beyond words. And so finding a visual language to communicate that research felt really important.
And I think tonally as well, the short film isn't fear-mongering. It isn't a devastating picture. The message it conveys and the findings of the research are hard-hitting, but the tone of the film gives it an accessible, informative feel, rather than anything that, makes someone feel that their experience was maybe less than someone else's. It's just, this is the overall picture. The imagery of the biscuits as well, it's a very calm, and I'm not sure how else to describe it, but I just find the tone of it really conveys that message in a way that everyone can watch this and relate to it, like you say, in a kind of unique experience of grief that we all went through.
I suppose mine and Matt's hope with the film was that really great art comforts the disturbed and disturbs the comfortable. And so there was a sense of wanting to comfort people that had been bereaved, but also draw attention to people that maybe had privilege that they could wield more responsibly.
I love that idea, Ellie. Beautifully phrased. And I think, when I saw the film for the first time, one thing that struck me is its pace as well, that it's quite slow and it kind of builds. It's not, so often we're kind of bombarded these days with kind of very fast, kind of loud, short clips and films. And I think I really like that it's slow. I think it makes you stay with what you're feeling. And it makes you really listen, especially with the different actors' kind of voices reading out. Those are direct quotes from our research. I think that's really powerful.
So let's kind of dive into the themes that are discussed in the film and the research. And one of them we've kind of touched on already is about the issue of time, and people feeling that the more time went on, they were somewhat less eligible or maybe could access less support in dealing with that grief that they'd experienced during the pandemic. I wondered maybe, Emily, if you could let us know your thoughts on how we could address or change those attitudes towards time and loss.
Yeah, I think time's really interesting, and I don't think it really varies by individual people, and grief is such an individual thing, and similarly when people need support is a very individual thing. And I think some people will feel that they needed it much earlier on, and then we'd find that other people felt that maybe they accessed it too soon, and they weren't actually in that place yet. I think there's a lot of assumptions kind of made at the moment in bereavement support and when people should be able to access it, but there's not really much evidence for when is the right time, and probably there isn't a right time because everyone is different, and it's really important, I think, that people are able to get the support at the time that's right for them and to be able to sort of revisit it when they need to, because it's not, I think there's this misperception that grief can be a staged process and you move through the stages and you don't go back, and I think that's it's largely recognised that that's not really the case, that people may need it at one point and then sort of carry on for a bit, and then something might happen, they may feel they need to go back to getting some more support at a later time point. So I think that came out in our survey, that people's needs for support at different times were actually very different. And you're right, in the film there was a story from one of the people who took part who felt that too much time had passed for them to be able to go and seek support. But then, we would also hear from people that had been trying to get support and were being told that they needed to wait at least 6 months before they would be eligible for support. So it's a really mixed picture. And I think the main message around it is it's a really individual experience. And services need to be able to respond to that, really.
And so it kind of leads on to an idea of disrupted grieving, which is this kind of sense of you're trying to deal with the loss of a loved one, but because of the different restrictions in place in terms of the ceremonies and gathering people, it kind of didn't provide the closure that was needed for people to deal with those losses. So I just wondered, in terms of your professional opinions or your experiences with grief, do you think it's a good idea for those people at home who might be listening to this episode to kind of revisit those ceremonies now that time has passed? Or would that in fact bring up some uncomfortable feelings and delay the grief?
I think that it really depends on the individual. I would think that for most people it is helpful to have a sort of meaningful ceremony when you're able to, or some kind of memorial or public kind of recognition, partly because it's an opportunity to bring everyone who knew that person together, and that provides a real sense of support for the person who's been bereaved. But I know Ellie does a lot of work in this area, so I'm sure you can probably say something interesting about this, Ellie.
And I suppose, I mean, in my lived experience, grief is tidal, so it doesn't stay still. It's constantly changing, moving, evolving. And so the more you can allow yourself to be in flow with that grief, rather than trying to wrestle it into some sort of order, the easier it is. And so, yeah, of course, using art or finding ritual, it can be really, really helpful for people. And I think we can think quite broadly in terms of what those rituals or memorials or celebrations might look like. So, for example, we've done projects where we give people seed paper. So it's paper that has wildflower seeds in it, and they write messages, and then everyone goes on a walk and they plant the seed paper. Or we've done various kind of memory workshops where people can take items of clothing from loved ones, and everyone sits and sews and creates new objects. And really, I think it's about having time and space to bear witness, and to be able to find spaces where we can say the unsayable. And I hope the film sort of begins to open up that space, or prompts that space, allows permission for that space.
And it's interesting how these questions of time and also kind of ritual and kind of revisiting past losses, how they really do reveal and tap into our sort of social attitudes to grief, and some of those misperceptions that Emily mentioned as well about what grief looks like and what it feels like. And, you know, this idea of grief being something you move through, or having stages, or there being a time in which you get over grief. The reality is actually much more complicated and individual, and, you know, what helps one person may not help another person. And I think that's one reason why it's so important that we have these conversations, and we kind of bring grief and bereavement out into the open to sort of actually question and confront and start dismantling some of those sometimes quite unhelpful beliefs which we have about our own grief and other people's grief. And we saw that reflected in our data in terms of, people thinking that they're not entitled, or too much time's passed, I don't want to bother my friends and family, people think I should be over it by now. And there's quite unhelpful social attitudes. I hope that by having these kind of conversations, we can sort of start to shift those.
I absolutely agree. I think one of the things we found in our coverage of the National Day of Reflection this year was about the importance of just having time and having that space for people to come together, communities or across the nation, just to have that moment to think about the 2 years that we have gone through and the large scale losses we've gone through, as well as things like national memorials, the wall down in London. We've recently opened up the COVID memorial in Scotland as well. So it's, again, just permission for people to come and grieve together or alone to commemorate those losses. So what response have you had from organisations or the public in response to this film?
So we first screened the film during Dying Matters Week as part of a film series put on by the Good Grief Festival. And I think in some ways I was a little bit anxious about screening the film, because it is such a sensitive topic. And we had also invited our participants to come and watch the film as well, which made it even more, in some ways, a little sort of nerve-wracking in a way, to make sure that we kind of depicted their experiences in the right way. But what was really nice was the way that the Good Grief Fest, and Lucy can talk a lot more about this, is people leave their comments in the chat. So we would, as the film was running, we were seeing all the people's views on the film as it was being displayed, and throughout the session where we were talking about it afterwards. And the feedback that we had was really positive, that people found it, although, it was a really sad it was a sad film in a way, and a lot of people were obviously affected by it. They found it helpful to see these experiences displayed in this way, and they thought it'd be done very sensitively. It was very poignant. So just seeing the feedback from people who'd been through these experiences and hearing that they found it a useful and helpful film was what mattered the most to me. Really, was just getting that instant feedback that it had been helpful in that way to them. In terms of organisations, I don't know, have you had much feedback from organisations, Lucy? Or
to be honest, we haven't really been pushing it to organisations yet. We're getting a shorter version of the film made, which I think will be a nice thing to share with organisations and for people to share on social media. But that's not quite finished yet. But yeah, I think I would just echo what Emily was saying, really, that we did have a degree of trepidation kind of launching the film, but we've had some really positive feedback, and we're also we're carrying on collecting data. So we got an extension, some funding to extend our survey to go beyond the initial time period. So we're doing kind of 24-month follow-ups. And we had some feedback last week, didn't we, Emily, from one of the research participants saying that she'd come along and she'd watched the film, and she just gave some really positive feedback in terms of people feeling like it did reflect their experiences, but it did so in a sort of sensitive way. And people also appreciating that we were trying to disseminate the findings of the research, not just to academic communities through research papers and presentations, but actually we were trying to reach the public and raise as much awareness as we can, really, about what people have been through.
I suppose that I shared that trepidation. I'm a multidisciplinary artist, so I work in performance and visual art, and film is relatively new to me. It's my second film project that I've worked on, and so I was definitely feeling the nerves. But what was really heartening was how generous all of the people at the screening were. So the chat, it really did open up conversations. The chat was going crazy with people saying, this reflects my experience, or thank you for making the film. And so it really was very, very beautiful to have such a generous audience there, and to know that there were people in the audience that had been the research participants, because we were really keen to honour people's stories as authentically as possible. And subsequently, I've had lots of lovely feedback from organisations. Leeds is where I'm based is really fantastic, and it has a kind of very active death positive community. So I've had lots of nice feedback there. Which is a huge relief, because it's an important subject and the research is so beautiful. It's important to honour it.
I was just going to say, Cheryl, I just wonder if it's helpful to talk a little bit about Good Grief. So Good Grief Festival was an online festival which we launched in October 2020, and we ran online in October 2020 and then twice in March, and for the Day of Reflection in March 2021 and then in October 2021. Just to echo what Ellie was saying, so one of the most rewarding aspects of Good Grief and of being present at the events and helping to curate it and direct it has been seeing that chat and the kind of community that builds up alongside the events. I was worried with it being an online festival and running online events that we would lose that sense of community and people kind of chatting. But actually, I think the opposite's happened. Actually, it's been really easy for people to access the festival, and we've reached people who maybe wouldn't have been able to travel or come to an in-person event. And I think we saw that in the film screenings, that there's a really nice community of people who built up around Good Grief, and almost all of them have experienced a bereavement in the last sort of 5 years or so. People say that it really, really helps them to kind of come together and hear people talking about grief in a sort of open way. And they're able to sort of recognise their own experiences and take solace in that, in the fact that we're all in this together. So if anyone wants to access the film and watch it, you can watch it for free on the Good Grief Festival website, and it's goodgrieffest.com.
So what outcomes would you like to see as a result both the research and the short film?
As outcomes from the research, I mean, we've been kind of making recommendations really as we've been delivering disseminating our research findings. I mean, and the sort of main recommendations have been around trying to improve people's experiences at the end of life and making sure that that the communication that they have with healthcare professionals at the end of life is as good as it can be, and that people are able to have as much in pandemic situations, people are able to have as much contact with their friends and family as they can in that situation. But also, moving from the end of life, going through people's bereavement, that they're able to then also access the support that they need from services. And, more broadly speaking, just that as a society that we're able to become a bit better at how we talk to people who are experiencing grief and bereavement. Through sort of different initiatives, really. Through sort of educational initiatives, through sort of awareness initiatives, through events like the Good Grief Festival are really important. So there's sort of the sort of different levels of sort of outcomes that we'd like to see from the research. And there's been some really exciting kind of policy initiatives going on at the moment as well, really trying to, work with research findings and other evidence that's available. Myself and Lucy are both part of the UK Commission on Bereavement, which will be releasing its report in September along with sort of recommendations for policymakers and decision makers to try and really improve the bereavement experiences of people across a whole series of domains, from end of life, from funerals, bereavement support, availability, community responses. So that's kind of one of the main ways we've been engaging with our research and trying to make sure that our research findings are kind of have an impact.
One of the things that I feel quite passionately about is that support is varied and it can be tailored to different communities and made by different communities for different communities. So in particular, it's really important that we have bereavement services that are run and organised and tailored for Black communities and queer communities, and that bereavement support doesn't become homogenous, that there is space for it to be tailored to different people's needs and lived experiences, and that communities feel empowered by that support, which is happening more and more.
Just building on what Ellie said, another dimension to our research study was an online survey and some in-depth interviews we did with bereavement services, where we explored the impact of the pandemic on bereavement services, but also other, we gathered other information about how bereavement services operate. And one of the interesting findings, and perhaps quite shocking findings there, is that for over 2/3 of the voluntary community sector bereavement services we surveyed, there were known inequities who accesses their support. So they said that they knew there were community groups who have unmet needs for bereavement support in their local area or in their catchment area who are not currently accessing their services. So I think Ellie touches on a really important issue. Moving forward, there needs to be recognition of the barriers that people face in terms of accessing care and support, both in end-of-life care and in bereavement services. And we found some of our findings were quite shocking in terms of, the barriers that people face. So we found that more than 1 in 4 people in our survey felt uncomfortable asking for support from services. And on top of that, around 40% reported difficulties in getting support from friends and family. So people are struggling and they do feel they need support and they do feel alone. So I think that is going to be a really important area. And bereavement services can't do that on their own. They also need investment and support in order to extend their services and provide the diversity of services which are really needed to meet people's needs. And then there was some really kind of, in a way, low-hanging fruit in that we found that, for example, only 1/3 of our participants had been given information about where to go for bereavement support after the death, which is incredibly low. And if they're not even given information about what bereavement support is out there, that's not going to make them feel comfortable looking it up and finding out for themselves, especially when you're grieving. It's really hard work and it's really exhausting grief. So to kind of have that additional ask to, you have to be the proactive one, it is really difficult. So I think we need to think more creatively and more inclusively about how we advertise services, how we raise awareness of what services are out there, and also how we try and make people feel that they're entitled to support, and that, if they want support, they're able to access the kind of support they need.
And certainly, I'm aware, I live in a really fantastic area in Leeds called Chapeltown, and there was a lot of people that are kind of community ambassadors, I guess, or people that share knowledge or share support services. And we saw the African community being incredibly inventive and resilient about how they could retain their funeral traditions whilst maintaining social distancing. So we ended up with these very long funeral processions where everyone stood outside their homes and bore witness to the people that have passed. And that was a really beautiful thing to see that was happening organically at grassroots level. So I think the more community ambassadors we can have to kind of bridge that gap between the amazing services that are available and the general public, the more useful it will be.
Do you believe that we will now be better equipped to deal with a kind of large-scale global crisis with losses of the numbers we experienced in the pandemic as a result of the learnings from this study?
I would hope that our research and the research that many other people have done on kind of end-of-life care experiences and bereavement during the pandemic would provide a strong evidence base if anything like this ever happens again. I suppose my kind of caveat on that is that I think our society is quite divided, and I think COVID in many ways has shown that people have very different views about what the best sort of public health measures were, for example. And I'm not sure if this happened again, whether that division would go away or whether we'd see, a reenactment of many of the debates and divisions which we've seen during the pandemic. But in terms of bereaved people, I hope that our research would provide guidance for services on how to best support bereaved people.
I think there are definitely some sort of clear messages around preparedness, for future, if we were in an unfortunate position to have a similar thing happen again. I think the research really highlighted the really awful consequences of the sort of lack of preparedness and ability, especially of like health systems to respond to people in hospitals at that time. Not having enough PPE, not having clear policies, not being able to connect families properly. I think that there's sort of clear learning there that you would hope, if it happened again, could be acted on to stop so much of the trauma that happened when people experienced the death. But then also I think there's been a lot of adaptations that have been made anyway, as services, funeral services, bereavement services, health services have had to adapt and move to online provision and find different ways of dealing with all of the restrictions and infection control measures. So I think that learning is going to stay, and I don't think the way services delivered is ever going to fully go back to how it was. I think certainly for bereavement services and probably other types of services, hybrid ways of working are probably going to be here to stay, which will, obviously mean if anything similar happens in the future, that transition is going to be that much easier than it was back in March 2020, when it was just a completely new, unprecedented sort of set of territory to negotiate.
So I wondered if you might have a message for anyone at home who's listening to this episode of the podcast. They've perhaps experienced grief during the pandemic and are still going through kind of that process, or they know of someone who could do with some bereavement support. What message would you give to these people?
I suppose fundamentally, first of all, I'm just so sorry that you went through that experience. I think it's been incredibly tough. Bereavement is challenging enough without all of the other challenges which have come along because of the pandemic. I think Please be kind to yourself and give yourself permission to need support, and please do feel entitled to support, because that's what it's there for. There's really good resources on like Cruise Bereavement Support website, and also on the Good Grief Festival website we have a resources page. Grief can go on for a very long time, and as Ellie said, it has waves and will come and go, and we're all entitled to struggle with that sometimes. And if you're supporting someone who's been bereaved, just to be there and to be the person who will sit with them when they're crying, or when they just need to be distracted from what's going on and they need a laugh, or whatever it is normal. And just try to be the person who stays present and who is able to be with that, whatever it looks like for that person at that time.
Absolutely. I suppose it was making me think that it's not too late for people to speak their truth. And I think we need some radical gentleness. And I think we need that with ourselves, to let us feel things that we might have been silencing, and also to be radically gentle with each other and give things time and breathing space. But it's certainly not too late to express those feelings, or mark those rites of passage or those losses.
Emily, any final notes?
Only really to echo what Lucy and Ellie have said. And I think just really to reiterate that, doesn't really matter sort of where you are in terms of your kind of trajectory following the bereavement, that, it's not too late to try and get support if you feel like you need support, if you feel like you need, to spend some time remembering, or, remembering the person and talking with friends and family, it's just to have that space, and to be able to get the help that you need if you feel like you still need the help.
And as much as we keep talking about it, hopefully it will help to guide people or point them in the right direction if they are looking for support for either themselves or a loved one. So I will be sure to leave all of the links in the show notes. For anyone who's looking to find you, can you share maybe websites or social media?
Yeah, so we have a website for my body of work, the Grief Series, and you can find that at griefseries.co.uk. And we also have a pack on our toolkit page, which gives you creative prompts if you want to remember somebody. So that's a free kit that people can go to if they want to engage creativity in remembering something they've lost.
And I already gave the website for Good Grief Festival. That's goodgrieffest.com. And via the Good Grief Festival website, you can access the Grief Channel, which is an online portal of all of our recorded online events from the last few years. And that's £20 to access for a year. And so, if you think that'd be helpful to you, please take a look and maybe sign up, and you can watch it in your own time. And you can also join our mailing list on the website as well, and be notified of upcoming events. And all of our events are free when they're live, and then we put them on the Grief Channel afterwards. And I'm also on Twitter, so at Lucy_Selman. And I generally post about research. So if you're interested in research in this area, then please follow me.
Yeah, and just to say that the study website also has links to bereavement sources of bereavement support, and it contains links to podcasts, to media, media articles, to the papers that when we release papers, we put them up there, and various other bits and pieces linked to the project. And that's quite an easy website to remember. It's www.covidbereavement.com. So for people interested in all of the other kind of outputs relating to the research, that's a good place to look as well.
Thanks so much to Lucy, Emily and Ellie for their time. We've put a link in the description to where you can find and watch These Four Walls over at goodgrieffest.com. That is goodgrieffest.com. You can also find the research at covidbereavement.com. If you haven't heard of us, Covid Aid is the UK's national charity dedicated to supporting all those significantly affected by the Covid-19 pandemic. We provide a range of supportive services, advice and information, including hosting our Covid Aid support community, where we host courses, events, expert Q&As, peer support groups and a whole lot more. for those affected by issues such as long COVID and grief and bereavement. Please visit covidaidcharity.org, that is covidaidcharity.org, and you can join our community at community.covidaidcharity.org. Thanks for listening, and we'll be back with you soon.